the last 2 years, yes? And we have a lot of to do. Regarding the primary use and secondary use of electronic data, this is not the main issue. It's what we have to do to ensure that this primary care, this primary data using and secondary using is going to be done. This is the priority categories for personal electronic health data for primary use. In the blue ones, it's the ones that Portugal is lock and load to go if the regulatory directive of the European Union was approved today. We can supply everything in blue, and I'm going to share what we are doing regarding the medical images. This is for the secondary use. All in blue, we are lock and load to deliver. All in black, we are still ongoing. Our concern is regarding human genetic and genomic and proteomic data for secondary use using that only point, because there are a lot of questions that are being raised. This information can be used, for example, for better outcomes in healthcare. For example, one pharma to treat lung cancer. Why it does work only in 41% of the patients? Because it costs 1.5 million. So better decisions with data, but also can be done or used to create bioweapons. So how are we going to share this information using that one entering point? It's one of the concerns. So this is the micro landscape that we are using the resilience funding from European Commission, the 300 million. It is distribution in these 4 axes in Portugal. So this is the main tool. It is the broker of the semantic catalog that can and allow everyone in Portugal to connect with everyone. Yeah. So, and this is the framework. You can, starting with the security and private governance, then the standards and the profiles certification, then you go bottom up. So first, the technique, the applications in the IT infrastructure. You have to build communication protocols, and for example, we are going to provide the interoperability platform for all the economic operators, public or private. So that is the first step that the governments can do regarding, okay, we are going to do this, and the governments have to finance this to allow the private operators to make the other steps. So, and the integration between systems, a portfolio of standards, it's very important, these decisions, because it allows us to standardize the information and to mitigate the security issues. The structure and the semantics, for example, we have to provision transversal information for sharing rules, and clinical guidelines for creation of technical network management mechanisms, creation of transversal technical mechanisms and policies and incentives, and finally, let's do the regulatory. Okay, because if you start bottom up down, it's not done. Because you were saying, and I totally agree, it's not enough to put on a law. Okay. This is the new platform that we are working on. It will be finished, I think, in 13 months. Yes, Sarah? So this allows us to share, by the way, we already put it a platform to integrate lab results, integrated lab results in the electronic health record. Since last September, we already have 100 million lab exams in the system, and this will allow to share all the labs, all the images between private and public hospitals, between the patient and the hospitals. And yes, we are starting to see the usage of blockchain in this. So the principle we saw in London, because we are always looking whatever you guys are doing all around the world. I am a patient. the physician in front of me, I generate a token with my mobile app, okay, and he will receive it and he will have access to my health record, because the health record is mine, it's not from the hospital, okay. So we are just testing, yeah, just testing, yeah. This is the data lake that will allow us to get the information to deliver for research. Okay, I'm not putting many technical details here that will allow to share information between private sector and public sector. And you can see if you are risk management expertise or IT, this is a complete nightmare that is coming up on us.